Hi, welcome to our live. We're so happy that you're viewing this, whether you're doing it live or not. Thank you so much for checking in. My name is Zoe, and I am the front office mammography coordinator in our San Clemente office, and I love this office. This is a beautiful office. It's friendly, and our patients are great. We'd love you to become our patient if you're not already. I think that's all I'm going to say right now. This is just a totally informal, as you'll know. I am extremely informal. I have no filter, and this is just who I am. So we're going to just play off one another. We're going to tell you some great information about women's health, and some of you asked questions, and we're so excited to be able to answer those for you.
All right, and I am Brittany. I'm the mammography technologist. I also do the bone density scans here in our San Clemente office. I like to think I'm a pretty inviting person, so I look forward to hopefully getting some of you in our office.
Hi, I'm Bridget Hallam, and I work with these lovely ladies, and we want to make sure that any questions that you have about your breast or your vagina or your armpits or your lymph nodes, anything that we can help answer that you don't feel comfortable talking about with other people, you can do it here, and we'll be happy to answer it. It may not be answered today, but we'll make sure that we follow up with you, okay? I believe that our first question is a really simple one that I'm going to start with, if that's okay? The first one that I have today is sometimes when I have my period, I get lumpy and I get sore breasts. Is that something to be worried about? This is sent in from Joan. So Joan, it's a great question, and so many people experience this. And basically the biggest thing I can tell you is that when you are right before your period, there's a strong, sudden reduction in your estrogen and progesterone hormone levels. And those hormone levels do make changes in the breast tissue. The estrogen makes your ducts enlarge, the breast duct system enlarge, and then the progesterone is the milk glands that they tend to get a surge and get a little bit bigger too. And both those hormonal changes can cause the breast to become very sore. So it's completely normal. And the good thing is, unless you have other clinical indications of the breast cancer is not painful. But you do want to always get it checked out if you do have recurrent pain. So the rule of thumb is if you have pain during your menstrual cycle or right before your menstrual cycle, is you want to make sure it goes away. We call that waxing and waning. It may come back next month, but as long as it's around your period, we know it's probably a fluid-filled structure because caused from that hormone changes going on. Guys have anything you want to add to that?
No, I didn't even know that.
All right, woohoo, success! We answered one answer.
Very good.
I usually like to tell my patients that we're looking for pain that's more consistent and like pain that you can put your fingertip on. So if you have a spot on your breast tissue that you can put your finger on and it's constantly hurting there, that's usually a little more concerning than like an overall tenderness that comes and goes.
Good. And that's another thing too, is that what we really want you to be aware of is a lump in the breast that's like Brittany said doesn't go away, and most of the time it doesn't hurt. It just feels like a weird hard lump. And we can say it can be as small as a pea, as large as a marble or a golf ball. But the idea of having the mammograms every year is to make sure that we're finding things when they're at that pea size or before that, when you don't notice it. So really good question. Thanks, Joan.
Cool. All right, I will go into the next question. Is getting a mammogram painful? So I would say they're uncomfortable. Painful, probably not so much. If it is painful, just please communicate that to either myself or your technologist. Sometimes it's just a matter of adjusting you. Just know that the better the compression, the better the image, so we can really help spread out that tissue and get a clear picture for the radiologist.
And just as a girl who loves being here and in this office, all of our technologists are great. Brittany's here in San Clemente, but the ones in Laguna Hills and Irvine are great too. And they really care. They take their time. This is not hurry up and get them out the door. We want you to be here. We want you to feel comfortable when you're here. We want you to be open. So that's that.
Yeah.
Let me ask, this is a really important question. Tiffany sends in. It says, I heard you can't get a mammogram if you've had the COVID vaccine. Is this true?
Great question.
Yeah.
Super important right now.
Really, I mean, everybody asks this all the time. And so recent research has shown that in some women, not all, but in some women, it causes your lymph nodes to be swollen in the arm that you had the vaccine in. So the recommendation would be to wait 6 weeks after your second dose so that you don't have any reason to maybe have to come back for additional screening just because of the vaccine.
Yeah, great question, great answer too. One of the things, like Zoe was saying, is that what we know about the COVID vaccine, or any vaccination, any immunization, anything you do, is your body needs to react to that in order to create those antibodies. So just because the lymph node's getting enlarged, it's actually a good thing. It sounds horrible, but it's actually a good thing. And you may not even know it's getting enlarged, and we're just seeing it on the mammogram because your lymph nodes are very superficial and they're very deep, and they are out throughout our whole body. And all of those, the function of the lymphatic system is to react to foreign bodies and fight off whatever infection it is and help the cells create those antibodies. The mammograms are showing on some women that that the lymph nodes are becoming enlarged. It doesn't mean that we want you to have that vaccine and then 6 weeks later you're still feeling this enlarged lymph node, so you're waiting to come in for your mammogram. Still come in for your mammogram, because it could be something else. But in most cases, at this time, if you're only having a pain in the armpit or a large lymph node, it's probably from that COVID vaccination. But always best to come in and get it taken care of so we can be absolutely sure it's not something else clinically going on, okay? Good question.
Very timely.
Very timely question. Good.
All right.
Got another one?
Sure. Okay, I'm breastfeeding. Can I get a baseline mammogram? So with that, the recommendation is to wait at least 6 months until after breastfeeding. The reason is when you're breastfeeding, the images will turn out really cloudy, making it really hard for the radiologist to see. So you got to remember with the mammogram, the goal is to find breast cancer when it's really small. And so if you have breast cancer and it's really small and you have cloudiness over the top of it, it's going to make it really hard to visually see for the radiologist. So definitely recommend waiting 6 months until you are finished breastfeeding to schedule that mammogram.
Make sure there are some cancers that can develop when you're pregnant and when you are breastfeeding. So it's still important that you're doing your self-exams and you're checking for anything new. You can have a condition called mastitis that can also be causing some pain in the breast when you're breastfeeding, and that needs to be looked at and treated properly. So make sure that you're still checking your breast even if you're breastfeeding. It's just the mammogram should be waited. You should wait on that mammogram 6 months after, like Brittany said.
That's great.
Yeah.
That leads me to this question. The question is, how often should I have a mammogram, and at what age can I stop having a mammogram?
We get that question so many times. How many times do you answer that question?
Yeah, a lot. So your baseline mammogram can be from 35 to 40 years old. But it's recommended closer to 39 and 40 because your breasts are less dense, right? Your tissue is less dense. So that's a great time to have your baseline. And then the second question to that is, when can I stop? You need to have them every year. And if your doctor found something that was cancerous, if you would treat it, if you would go through chemo or radiation or whatever it is, then you'll continue to have your mammograms. If you find something and you have chosen with you and your family and doctor that you're not going to treat it, then you really don't need to have mammograms after that. So that's totally dependent on your personal situation. It's not an age.
That's a great point. So keep having those mammograms, because remember, mammography is the silent killer. You don't really know you have it until it gets to that point where you're feeling it and it's a lump or a bad thing going on. So mammography is really important to have it so we can catch it at its earliest stage. I have a funny story, if I can share with you. I had a 92-year-old woman who came in to see me some time ago, and she took her gown off so we could do the exam, and she had this beautiful rose here, and she says, "Oh, I get this." I said, "Oh my gosh, I love your tattoo, it's gorgeous." And she said she got that when she was younger, and she had it retouched every few years to make sure it stayed beautiful, because she told me that she felt that as she got older, that her rose right here would become a long stem rose.
Oh my gosh, that's so cute.
I love that.
That's the kind of spunk and the vigor that we need in our women who are pretty sure that after their mammogram they're still going to do something if something is found. So when you come in at 92 and you're still having your mammograms and we find something, be aware that we're going to treat it for you as much as we can. and what you can tolerate. And that's always a good question to have with their gynecologist or primary care physician too, to see what they feel based on your medical history and your medical background, if that's something that also needs to be taken care of.
Yeah, I think that leads into how important your monthly breast exams are, your self breast exams.
Good point.
Can you talk about that? Because
Go ahead,
I'm
Britt.
not good at that.
Britt's good at these.
So I mean, there's multiple different ways. From my personal experience, I've been told the best way to do it is just when you're in the shower. One, your tissue is nice and relaxed. You can just honestly hold your arm up in the air. Use 2 fingers and kind of just go in different motions. You can go in circular motions. You can go side to side. Basically, you're wanting to feel anything that feels abnormal for your breast tissue. So, dependent on your breast type, sometimes you're going to have lumps in there, but you're looking for something that doesn't feel like the rest of your lumps. So, like Bridget mentioned earlier, sometimes it's like the size of a pea. And what I usually tell my patients is something that's like squishy and mobile is probably not so concerning. Don't totally rule it out, obviously, but we're more so looking for something that's like really hard, something that feels like a pebble. That's kind of a good description for something that might be a little bit more concerning. So just always be checking your breast tissue. Don't overly do it either, though, because that's something I've personally done myself. You know, you sit and overly do it, and then you freak out and you think you feel something, but it's probably normal. And I've been there, done that, gone and gotten ultrasounds, and everything's checked out. But always rather be safe than sorry. So just be feeling for anything that feels abnormal. If it's something that concerns you, you can always schedule an appointment and you can get it taken care of.
And that's a good point, because we get a lot of people in our offices that go, gosh, I felt this lump, and now today I come in here for my mammogram and now I don't feel it.
Mm-hmm.
And that's a good point, because it's really important to know as you do these, like Brittany said, as you do these over time, and if you do them consistently the same way, you'll really get to know your breast. Mm-hmm. And then, okay, since this is a very informal thing, girls,
yes.
I want to tell you that I've been in the field for a long time, and I've heard a lot of great stories, and I've learned a lot from these stories. And one story that I heard, or several stories now, but at the time it was brand new to me, but the lady told me that her husband found her lump, and that's a great thing to do. If you're not comfortable touching yourself, you know your partner is going to be touching you, have them touch you. And when they do that, don't have them touch you in like, they can touch you in a sexual way, that's fine. However, make sure they're doing it as a clinical kind of touch as well. And when you do it, you're gonna, like Brittany said, extend that arm up, make sure that they're checking all the different ways. And they're probably gonna be the one who know your breast best, honestly. But we do have a lot of people who come in and say, well, my husband or my partner or my spouse or my boyfriend, whoever, found my lump. So there's always other options too. And then the other thing too is make sure your doctor once a year is doing your breast exam as well. So you're getting 3 different ways of checking for breast cancer, not just mammography, but also doctor and self-exams monthly. And the monthly should be, if you're still menstruating, it's a week after your period. I'm getting COVID messed up. So when you have your menstrual cycle, you want to check for your breast lumps on yourself monthly, like 7 days after the first day of your period, which is when those estrogen levels are kind of back to a normal, right? Is that right? Sometimes I forget.
It sounds really good.
Yeah.
Just do it then.
We are here to help, not confuse you.
Yes. Very good. Any other? Yeah.
I have one, which is also a great question sent in by Tracy. Tracy says, my mom has breast cancer. Am I going to get breast cancer? Mm-hmm. This is a super controversial thing going on. A lot of people didn't know, and Zoe and I talked about this before the live cast, there's not just one type of breast cancer. There's tons, and I don't know the exact number, but there's tons of different types of breast cancer. Some breast cancers come in the form of masses that we're talking about earlier. Some come in a form of calcifications that show up in the breast that are a common form in the duct system of the breast. There's also cancers that occur in the nipple. And then there's, on the other side of that, there's some that come inherently because you have a strong family history. And when I say strong family history, I mean mom, daughter, or sister. And then it's also important when they had breast cancer. If they had it younger, between 40 and 50, they could be carrying the breast cancer gene. So we check for, there's several different ways to check for breast cancer by blood work. One of the genetic testing is called BRCA1 and BRCA2, and those check for breast cancer and ovarian cancer, and that's the most common one that people have heard about. Hoag has a great program called HERA program, and it brings you in based on the type of breast tissue you have after you've had your mammogram, and they give you really good guideline and a consultation to tell you what your risk factors are. If you have strong family history or even distant family history, they're a great resource to contact, and I can have our marketing people send out that information, so if you want to contact them or if you want some more information, they're absolutely happy to get it for you.
You know, I get a lot, not a lot, but often since I've been here, women who say, I don't know, I'm adopted.
Right.
So what's their next level of finding out? Is it just the self-exam, the mammography, and maybe the BRCA test?
Yeah, I think there's all kinds of even spit tests now. There's the color test, and there's a bunch of other tests that they can do that are fairly inexpensive. The BRCA test used to be really expensive. I don't know if it's got, insurance didn't cover it unless you had someone in the family who had it. Now, one thing I wanted to keep in mind too is that if you have someone in your family that's got breast cancer, they're the ones that should have the blood test. They're the ones that should be checking for BRCA1, BRCA2, and all the other genetic tests. And the reason for that is if they're a carrier, number one, the insurance will pay for it. And number two, if they have breast cancer, and then the insurance will pay for the blood test. And if they are positive, then not only will it help you appeal the insurance to say, hey, pay for this, I've got it in my family, but it will also maybe negate a risk factor for you saying, okay, I don't have it in my family. Keep in mind that even if you don't have the family hereditary type of breast cancer, people, 1 out of 8 now? Mm-hmm. 1 out of 8 women still develop breast cancer who have no family history at all.
I have a question about that then. So I've had a mastectomy a million years ago. I never was tested because it was a million years ago. I never had a mammogram because it was a million years ago. My question is for my daughter. So yes. Would I test positive or negative even though I have had a mastectomy because it's a blood test? Would that be something I would do?
If you had breast cancer, you're alive, you should get tested first.
Mine was prophylactic.
If yours was prophylactic, then it's still up to either you or her. Okay. Right?
But would it be good for me to know if I have the
Yeah,
gene?
absolutely. Absolutely.
That's interesting.
Yeah.
I never even thought about
that. Yeah, I did the color test, and the color test does a bunch of the more common ones like colon and breast and stomach and all these real common ones, and it gives you a good preliminary that's less expensive, and I think maybe $100-$200, and it's a spit test. You send it in, they send it back to you, and then if any of those come back, of the 50 that they test for, if any of those come back positive, they put you in touch with a consult with their team, and then they'll tell you what the next steps are.
That's cool.
So it's pretty cool, and I know that the HERA program at Hoag does the exact same thing.
Good.
Yeah.
Good.
Yeah.
Cool.
Yeah. Good.
All right, I have another question.
How are you guys doing out there? Send in your questions because, we're here and we're ready to do this, and we're answering the questions that we've gotten fed today. But send in some more questions here at OC Women's Health Group, and we're happy to answer questions while you have us.
All right. Next question is, I have implants. Is it still okay to have my mammogram? Oh. Yes. So I wish I could tell you no, because I know you're probably wishing that's the answer. But yes, please come in even if you have implants. We do it a little bit differently. So normally there's a standard 4 pictures. We will do 2 of each view on you. So basically what we're going to do is we're going to do top to bottom views and side views. We do them with the implant in place first with very minimal compression. We basically just want enough to kind of grip your tissue, see the overall breast tissue with that implant in there. And then after we're done with those views, we're going to walk that implant back and do pushback views. For some patients, that can be a little bit more uncomfortable than those first few, But again, just always be communicating with your technologist. We can make adjustments to make it as comfortable for you as possible. Those pushback views are so important because when you're doing that implant in place view, your implant is kind of hiding some of that natural tissue. So the goal behind pushing it out of the way is so that we can get good compression on your natural breast tissue and really spread it out so that we can see everything clearly.
Brittany, can you tell me or tell our group the difference between an implant that's in front of the muscle and an implant that's behind the muscle and how that relates to a mammogram?
In the sense of like positioning or?
Yeah, why it would be more important to have one type of implant in front of or behind?
Might let you answer.
I was going to say, how did you do that? This is the informal part. Could you take that?
Yeah. So, I'm not going to say in the olden days, but because they still do it now. But I have implants, so I'm going to say that out loud. But we want you, if you're going to have implants put in, without having a mastectomy and you're just doing it for cosmetic reasons, it's more important to have that implant behind the muscle if possible, because when the implant is in front of the muscle, that means it's actually inside the breast tissue in front of the muscle itself, and that implant makes it's much harder to do the pushback views that Brittany was talking about, and then we don't get as much breast tissue. And in those cases, it's really important that you're doing your self-exams because there's some tissue that we can't miss. When you have the implant behind the muscle, we can push that implant farther back into the cavity, and we're actually getting the whole breast tissue, or 95% of that breast tissue. And then sometimes we do a few extra pictures just to make sure we have everything on those. But it is important to have it. One of the cool things about implants that a lot of people don't know is it makes the breast self-exams, the monthly ones, a little bit nicer when you have implants, because the implant actually pushes, let's say, a lump or a cyst or whatever closer to the surface of the skin, so when you're palpating you can feel it. So that's why it's really important to do it on a monthly basis and very consistently, because if you could have a cyst that's always there, or an intramammary lymph node that's in the breast tissue that you're going to feel constantly, and if you know it's always there every time you feel, you know it's probably nothing, and you don't have to panic or get in for that mammogram right away, because you know it's always there, and the implant makes you feel it more, so you may feel more things when you have an implant. That's what I'm trying to say.
Interesting.
Yeah, right?
I've learned a lot working here.
Yeah. Another note on that too, so I know a lot of patients come in with implants and they're really nervous for their implant to rupture during the mammogram. So I actually thought the number was a lot lower, so this number is really surprising to me, but implants can withstand up to 200 to 300 pounds of pressure before experiencing a rupture in today's procedures. So we don't come anywhere near that during a mammogram, just for reference.
No, that sounds frightening.
Yeah. So just keep that in mind, that it's going to be very, very challenging to rupture that implant during a mammogram. And again, just be communicating with your technologist. If you feel like uncomfortable and it feels like it's going to rupture, I mean, it's probably not, but please communicate that with your technologist so that they can either lighten up the pressure or just reposition you to make it a little bit better for you.
Don't suffer in silence.
Yeah.
I think we're all so used to like wanting not to bother the doctor or the technologist.
Yes.
Like, I guess this is just the way it is.
Yes.
But don't suffer in silence ever.
And on that note too, it's when you come in for your mammogram, whether it's a regular without the implant or with implant, it's so important for you to come in relaxed. The more worried you are, the more anxious you are, it makes us positioning you a little bit more difficult, and it's harder for us to get all of the tissue that we need to get. So come in with a good mindset, come in as you're coming in to meet with a neighbor or a friend and hang out and chat. Brittany, I know, is really good at making the patients feel super comfortable. And even before you get back into the room to change, Zoe wants to know your life story. She's so sweet. Couldn't ask for better employees. But yeah, it's really, really, really important that you do that. And when you were saying those numbers, which I'm super amazed by,
That's shocking.
it makes sense, right? Because your breasts, they don't make them so that you don't, like if you're in a car accident, they're gonna pop, right? I've been doing this, and now they make them so that they have double lumens, double capsules around them, so people can have the inside that may rupture, but the outside doesn't, so it doesn't leak into the breast. It makes total sense when you stop and think about it. And nowadays, with the advanced technology, the machine will only let us compress so much anyways. And like she was saying, that 200 to 400 pounds of pressure, that's a lot. We get maybe 20 pounds of pressure, to put that in perspective.
I have a question about that. So patients come in often that have an encapsulated implant.
Yeah.
How does that impact the mammogram?
Yeah. So encapsulated implants are, we all look at each other and go, I'll do it. No, you do it. No, I'll do it. No, you do it. They're a lot more challenging.
I'm glad I don't do it.
They're a lot more challenging in a lot of cases, because what an encapsulated implant is when your implant is put in, the doctors or those surgeons tell you to do your massages, and that's to break up that scar tissue and make sure it's not forming. An encapsulated implant is when that scar tissue is like pushing on it. So if you can imagine a balloon, squeezing on a balloon, and how it gets like, you can see the balloon edges or the skin of the balloon get really thin and bulging. That's kind of what happens on an implant when it's encapsulated. And it does increase its chance of rupturing more because the outline of the capsule is thinner. But I've been doing this for 25 years, and the only time I've ever ruptured an implant is during a biopsy, and that was from the needle.
Okay, got it.
So I've not heard of that.
Good.
We do have some patients who do get a little bit of bruising. So if you have a blood condition, or you know that you bruise really easily, like anemia or anything like that, let us know. We can absolutely adjust to that. As we get older, our skin also gets very thin underneath.
That's just one of the things that happens.
And so it's really important that we take a special care on that. But it's really important for us to not just, I don't know if you know this on a mammogram, but we don't just put the breast up there and press down, right?
That's what everybody thinks,
Everyone
and that's what
thinks
all the cartoons do.
Right.
You know, every cartoon has this
Right.
smushed together.
Exactly. And it's actually a little bit more complicated. And what we do is we actually pull the breast up and we pull it out, and then we use our hands and the paddle to press the tissue down. That way we're getting everything, because you have breast tissue all the way, some people have it way back here, and we call that axillary breast tissue. It's not armpit tissue, it's axillary tissue. It's not fat, it's actual tissue. It has fibers in it that are breast tissue fibers. So we are able, as technologists, to assess when we look at you. When you first take your robe off, we look at the breast, so we are able to assess what we actually need to do and how much tissue we need to get, and that can determine how much we lift up or pull out. But again, if it's like we've consistently said, it's important to let us know, because we can always do different pictures and not make it as uncomfortable for you. But sometimes you do tear underneath there if your skin's very thin. But let us know, we can put some antibiotic on it before you leave and some Band-Aids. Okay?
Good.
And on that note, with the lifting and pulling, that's another reason why relaxing is so important, because if you're really tense, your muscles are going to be flexing, which means your breast tissue is going to be less relaxed to where we can't pull you in as far. And I mean, if you're going to go through, the discomfort of getting a mammogram, we want to make sure to get all of you on there. So the more relaxed you can be, the better, so that we can really pull that tissue in. It also really helps with pain. So if you think about it, for instance, your pec muscle right here, if you're flexing that muscle, it's going to...
She just wanted to show us her guns.
Take your shirt off and show us those guns.
So if you're flexing it, it is going to resist that compression that much more. So it's making that tissue more firm, so the compression paddle is going to have a harder time coming down, which means either we're compressing harder to really smooth out that tissue, and it's just going to be really uncomfortable. So if you can kind of relax, which I always tell my patients, relax. I know it's easier said than done, but relax. It really does help with the discomfort and really helps us get a way better picture on you.
I hope we too just kind of have created an environment that's relaxing for people, so they don't come in just, it's like doesn't feel like a clinical office, it feels beautiful and it smells good and it's fun.
Yes.
And she's awesome.
Yeah.
Sweet and kind and tender. Yeah.
Exactly what I was going to say. We're so lucky, because not only do we have beautiful women that work here, they're smart too. They have exercise, so they take very good care of themselves, And it's kind of a treat to see that, because you can tell that we care not only about our bodies, but we want to make sure that you're caring about yours as well. So make sure you come see us at Orange Coast Women's Medical Group.
That's right. We would love that.
Do you guys have more questions?
Yeah, I actually have one, but do you have any more mammography questions? Because I have one that's kind of more maybe bone density related, that's just about calcium and vitamin D. Do you want me to go?
Why don't you throw it in?
Okay.
We can swap right you guys
Okay.
over here.
So we have a question. It says, how much vitamin D and calcium should I take? So the recommended dose of calcium is 1,200 milligrams, and of vitamin D, it's 2,000 IU. And for bone density health, right, bone health, you really need to take the two together because it helps the absorption rate. You can take vitamin D alone, if that's what you just need, the vitamin D, but if you need calcium as well for bone health, you really need to take them both together.
So you said how much to take, but is that a month?
No, it's daily.
Daily.
Yeah.
So how
Did
much
I just make that up?
No, that was
Okay.
how, can you repeat that
Yes.
again? Because I might have missed it.
No. 1,200 milligrams of calcium per day and 2,000 IUs, which is international units of vitamin D per day.
That was great. She did awesome. One of the things that I want to say, and if you missed my bone density talk the other night, it's online and we can hook you up with that. Sorry,
We're back.
Technical difficulties.
I hope we're back. Are we back? Okay, cool.
One of the things I want to add is it's really important that you look on your calcium that you're taking. There's different types: calcium carbonate, calcium citrate. Carbonate, one of the things that you look for on the tablet when you're taking the pill bottle, because we get this all the time in bone density, which one do I take, and not only how much do I take, but I have problems taking it, so how often do I take it? A couple things that are important is when you look on your pill bottle, might be an amount there might be a little tablet in there that says elemental calcium. The elemental calcium is what you really want to take. That's the amount that you're looking at. Sometimes it's in a percentage. You just divide whatever percentage is by 100, and that's how much you're getting. So if it's 40%, you go 40 times 100, which is 40, and that's 40 milligrams, right? So you want to continue to add that up. So get one that's kind of high and a higher percentage, right? Because you want to take 1,200 milligrams of calcium a day. However, your body only absorbs 500 milligrams of calcium at any one time. And that's if you have it with the vitamin D. So super important that you don't take, for me, it's a little confusing because I don't want to take 1,200 at one time because that's too much, but I don't want to take 500 because it may only be absorbing 250. So I always tell everybody take a little bit over 500 if your stomach can handle it with your vitamin D, and make sure you're looking at that elemental calcium.
So do you take that 3 times a day then?
You can take it throughout the day. Yeah, okay. Monday in the morning. A lot of people take 1,200 and they'll take 600 in the morning, 600 at night. And some people, the calcium bothers their stomach, gives them constipation or whatever. And so, you have to make sure you're.
Sorry.
You have to make sure that you're able to tolerate it. So start with 400 or 500 and make sure that your stomach can handle that.
Good.
Yeah.
Anybody else?
Yeah, I had one that I thought was a good one that we get a lot too. Is it true, this one comes from Jocelyn, is it true to say that soy, caffeine, deodorants, or an Underwire bra can cause a lump in the breast? So I'm going to break those down. So caffeine, it's not fully understood about how much caffeine does, but what we do know is that caffeine can cause some changes in the tissue, so the dense, fatty, it can change that tissue type a little bit if you drink a lot of it, but it doesn't cause cancer. Okay, so I want to make sure that's clear. And the reason that it can cause some pain in the breast, or what you may feel the tissue changes in the breast, is because we used to be told that the wires, the caffeine, I'm talking about caffeine, but that's what I wanted to say, that caffeine does not cause cancer. Some studies even show that caffeine may be helpful, but not a lot. So as always, do everything in moderation, okay? Deodorants.
The M word.
The M word. We don't use it, we use the M word here.
Yeah.
The deodorants cause lumps. So it used to be said that antiperspirants had an aluminum base to them, and some still do, a lot of them actually still do. And that aluminum it was controversial whether the aluminum was causing the a breast cancer or a breast problem, or if it was the aluminum pieces that are absorbed into the skin that on a mammogram shows up as what we call calcifications, and then a lot of people are getting false positive exams. So what I can tell you is that if you can find aluminum-free deodorant or perspirant, I know Dove makes them, it's probably always best if you're concerned about that. We do have you nowadays, when you come in, we always tell you when you schedule your appointment, please do not wear perfume, talcum powder, deodorant, anywhere. And when we say anywhere, we mean shoulders to torso, because all this we want to look at. And we want to make sure nothing gets dropped on it, or
Everybody wants to look at all that.
Yeah. all this.
I told you I was unfiltered.
Yes, this is what we are. We're a bunch of friends hanging out, answering some questions. So if you can go with that, that would be best. Aluminum free. And then the Underwire bra, that was the other one. Is Underwire bras do not cause breast cancer. Normally they don't even cause lumps. Well, what has been said is that sometimes it can, if the bra is very tight, it can cause some lymphatic fluid to build up, and it can make it feel swollen. So, if you can, I would say wear, like an exercise bra when you're at home at least, so you're not causing that. Also, I know some of like Nordstrom and some of the higher class department stores have people that will actually fit you, and they'll tell you. Because one of the things that I didn't know, and I had to teach my daughter, it just came naturally, so I didn't even think to teach her this, but one of the things many women don't know is the number, the 32, the 34, the 48, that's the amount that goes around here. Mm-hmm. So even though, as me, we all have weight here, this weight is going to be different here, or this size here is going to be measured different than here. So you may be 42 down here, but you're only 36 up here. So it's really important that you get fitted here to get sized properly, so that doesn't happen. And then this part, the breast part, is the cup size. So they're completely different. So you really need to be professionally checked, or there's a lot of stuff on Google Dictionary, that tells you how to do it if you don't feel comfortable having someone else do it for you. Or you can come here and, we can size you up. 34 double D.
There you go. I have a question about that. I've heard that if when you're at home you say wear a sports bra or something, what if you wear no bra at home? Does that make your breasts more saggy?
I don't know.
I think it does. I'm going to say yes.
I would think it does, because
okay,
as we get older, we lose our elasticity and our collagen and our breast tissue, and there's these little things, if you're ever in and you want to see the mammogram, we can't tell you what's on the mammogram, but we can show you what your breasts look like on the inside. But there's these little things called Cooper's ligaments, and those Cooper's ligaments, as we get older, stretch out, and that's what causes our pendulous breast. So I don't know how much a bra helps, because I know that after implants they tell you that you don't have to wear a bra, but then as you get older, even with implants, they tend to get longer. Yeah. So I would imagine that it's an age-related thing. Yeah. But
well, that's good, because I ripped my mask off, I ripped my bra off, and I'm,
Me too.
There we go.
My husband just laughs at me.
Yeah.
You comfortable now?
Yes, exactly. Very good.
Any questions?
I think we're good.
I have one that's kind of this is one of those things that we also want to tell you, is that we're not, even though we're mammography people, we promote women's health. We don't know all the answers to everything, obviously. However, we will do our best to find those answers out. One of the questions today that I don't have a complete answer for is, this was sent in anonymous. It says, how long can it take to resume my daily activities after chemotherapy? First of all, I'm really sorry that you're having to go through chemotherapy. I pray all of us do that you're doing well and you're a fighter. And of course, if you need anyone to talk to, we're always here to help talk and at least network. We have enough people in network that we can help you if you need that answer. If you need help or support. To answer the question, I think that's a great question for your oncologist, because they are the ones who know everything that you've gone through. Some people handle chemo very well. Some people really, really struggle with it. I wouldn't push yourself if you're going through chemo. You do what you feel is good for your body and what you need to get through that horrible experience. But I also feel that if you can get up and walk it every day, a little bit, I think that's going to be really helpful for you. The faster that your body can get back on the workhorse or back onto resume your daily stuff, I think the better you're going to feel mentally for yourself. But definitely don't push it. If you need time to sleep for 4 days, do it. There's nothing wrong with that. But definitely speak to your oncologist or any of your primary care doctors, and I'm sure based on your medical history, they can provide a much better answer for you. Okay?
I think we should do this again.
I do too. I feel.
Or you guys, anyway.
We're gonna mess up.
My heart is beeping, but I'm sure people are asking questions as
Yes.
we're talking,
Yes.
and we can't see them. So we will make note of them, and then we'll do this again maybe next month or something.
Yeah.
Maybe we should just start having a little chat like this every now and again as questions come in.
Yeah, and if you're able to respond, please give us some feedback. Let us know, oh my gosh, you guys were super, really ridiculously horrible. I don't want to know, TMI. Or let us know how we're doing, because this really is to help you.
Yeah.
And if we're not helping, we don't want to waste your time. But if it's really helping you, or if there's other questions, now you kind of know how we set up our forum. Very informal. If we could have you come in and hang out with us, we'd have some mammograms and mimosas, but
There you
we
go.
just can't do that yet.
The other thing too is share this with your friends, because so often women don't talk about the things that women don't like to talk about.
Right.
We are all about talking about lady bits, and
Yep.
we just want to be sure that you're healthy and that you have a forum to come to ask questions. And if it's something outside of our scope, we'll find the answers so we can share them with you, because it's important to be able to have open communication about things like this, not having to wait for your annual with your doctor
Yeah.
to ask them. So ask away.
And the last thing one of the last things I want to say, and I'll let Brittany talk last, is at Orange Coast Women's Medical Group, we really are whole woman. We care about everything. We have associated with our Hoag affiliation now, because now we're Hoag as well. We have providers in the San Clemente office. We really love it because we have our HMG Hoag Medical Group providers here in this building with us, where our mammography office is located in Bone Density. And you can come and see your primary care doctor with HMG. They can send you across the hallway and have specialized gynecological services for you, or your annual pap smear, and then you can finish up your day by coming back here and have your mammogram and bone density. We also offer lab draws at almost all of our offices, and we have 8 offices now, pretty much all over South County, California, and we're super excited to keep expanding and keep providing services to you guys. But we do other things besides just that. We see pediatric children in some of our other offices. The Foothill Ranch has a wide variety. We have circuit training there. We also have in our OCWMG office in Laguna Hills, we provide the Mona Lisa, which is a vaginal rejuvenation, and it's amazing. And so we do a lot of things for everybody, and we offer a lot of community services through Hoag, a lot of Q&As, and we just really care about you guys and really want you to know that we want you to come in and make sure you're taking good care of yourself. Right?
All right, I think I just want to part with, if you haven't had your mammogram, please come see me. We have availability, so feel free to call our scheduling department and get that scheduled, and I'll be here for you.
And the scheduling office phone number is 949-829-5533. So
Okay.
call us.
Call us. We look forward to seeing you guys. Have a great day. It's almost Friday, and we so look forward to seeing you here in the office, and Brittany is amazing, as well as all of our other technologists, okay? Have a great day, guys.
Thank you.
Bye, guys.
Bye.